You pop that going. There we go. So the other people I've got with me is Adam, that you've not met before. Adam's another new member of the team.
Hello, I'm Adam. Thank you, Gemma. I'm the new membership and alumni manager. I also started in January with Harsha. And congratulations, everyone, on your celebration day. And I'll say a few words at the end about some of the benefits that will come your way when you finish all of this. Thank you. Speak later.
Thank you, Adam. Thanks, Adam. And the other person that we have with us today is Claire, who you've already met, but Claire's going to spend some time giving you a few words of reflection and encouragement to start us off today. Now, Claire won't have introduced herself in this way when you met her, but Claire works with us really closely in the foundation and is actually one of my favourite people. And the reason for that is Claire is one of the most humble and dedicated professionals that I've ever had the pleasure to work alongside. So it's for me a real pleasure that I have the opportunity to let you have some insight into Claire's perceptions and Claire's world. When she's delivering her QI materials, you'll get a little snippet of Claire, but in a session just now, she'll be able to tell you a little bit more about herself and her view on your potential to influence. Now, if you look at Claire's biography, it's as humble as she is. She doesn't shout and scream about her achievements, but Claire's had over 30 years of experience working in the health, social care and voluntary sector, and has a real specialism in end-of-life and palliative care. And not only does she have a specialism in that, she's been recognised for that. She has an MBE for her contribution to end-of-life care, and also received a Lifetime Achievement Award from the International Journal of Palliative Nursing. So this is somebody that comes to us with huge amounts of respect and accolades, but probably the most important thing is her work ethic and her values, and she brings that to her input that she gives all of our programme participants when she works with us at F&F. She's also one of our Nightingale Frontline facilitators. So if those of you who are in organisations that are members of the Academy or who have signed up for the Nightingale Frontline sessions, and actually if you're working in the NHS for the whole of the month of March, they're going to be available to any NHS nurse or midwife and nursing associate. So if you do want to spend a bit more time with Claire, look out for the sessions that Claire's facilitating there as well. Over to you, Claire.
Thank you very much for that build up. I'm all embarrassed now. I always say I've worked with amazing people, and it's all about leadership and work, getting the right people around you. So this really fits in beautifully to what you're doing as part of the celebration. So I'm delighted to be joining you today. It is a shame we're not physically going to see each other, and as we always said, we only see each other from the shoulders upwards. We don't know how tall anybody is, or short, or fat, or round, or anything. You know, I've definitely got a bit more rounded since lockdown, so it's diet time. So it's great to be with you. I can't believe how far we've come in the last year. I mean, it's been quite amazing, hasn't it, what we've done? And I just think, like Gemma said, it's like no other year that we've had to experience. And you probably all experienced both personal and professional challenges. I know I have, and I'm sure it's no different. But I don't know about you, but I'm thinking there is a bit of light at the end of that tunnel now. We might be able to start at some point socialising, which would be joyous. So I think thinking about that, but on your professional level, I think you've taken massive steps in being part of the Florence Nightingale Foundation Leadership Programme. It's just such a great programme to be part of, and have such great opportunity. And I'm sure if you're like any of us, I'm sure you've had moments where you've been you've been listening to us going on as facilitators and trainers and thinking, oh yeah, that bit connects. Not quite sure what they're talking about. New language, new ideas. But actually, once you reflect and stand back a bit, you think, oh yeah, I can start to see how it fits in. And that's all the joys of a leadership programme and, moving forward. So it's really thinking about that. I think also as a group, Susanna and colleagues, we've really enjoyed working with you because I think you've really shown that sort of curiosity, participation, and going with the flow. Because I still remember your faces when we started and talked about the coin spinning, those blank looks thinking, where are they going with this one? But you stuck with us and you actually learned loads as well from it. You know, the learning you came back. So it is about trusting us, going with it. You never know what you might learn. So, you know, sort of thing. And I think the other thing that I loved as you as a group was very much thinking about when we were doing looking at the aim statements, that curiosity. You really were, you know, you were very much into problem solving, but we're saying, no, stand back. You've got to just critique the statement, not worry about solving the problem. So that was great. I think the other thing I would sort of think about in relation to QI is that quality improvement is a really important tool in your armory, as it offers you so many opportunities. So it's also thinking about what are the, you know, I know there's challenges, but once you actually get, and we'll come on to your posters in a minute, it really can improve patient care and also help with team working. So it's something that is ongoing and something to learn about. And as we always say, remember that quality improvement is a team sport. We need to make sure we're getting everybody in it. And sometimes people don't always want to be in the team, but it's trying to think how we can get them. And we did talk a little bit about that. But what the key thing around quality improvement, and I think I'll come on to your posters, which I think have seen some great examples, is that you've had clear aims. You've said what you're going to measure, and you've come up with some great ideas of how you're going to show that you've made a difference. But I think now moving on as well and thinking is sustainability. How do you make the improvements that you've made stick? Because, you know, that's some of the things you can be all generated exciting, but how do you make it stick, and how do you continue, and how do you make sure people take that on? So reflections from your QI projects, I think there's some brilliant examples. And Jo Matheson, who I don't know if you've met here, she's on the call today. We had great pleasure in reading your posters. You really helped. We were really interesting topics. And what I loved about you as a group, you're all varied topics. Sometimes we get all the same topics, but we didn't. We got such a variety. So from looking at better uptake from family interventions in early psychosis to improving physical health, better management of diabetes, improving outpatients experience, handover, training and communication, just to name a few. So you did lots. It was really great. And what we loved about it was that you really had some very clear, you really said why you picked the topics. And it was a challenge. I know it was a challenge to do it in a poster format, because it's easier to write loads than write a little, but you did really, really well. And I think the other thing was that you really showed that you were really trying to use the model for improvement, which was great. Good baselining, some demonstrations of how you made impact, but also because of the challenges this year, some of you were at the planning stage, but that was fine because you can really see what improvements, because it is an ongoing sort of experience. And you did use both qualitative and quantitative data, which was fantastic. Some great graphics. A picture tells says 1,000 words. Remember to use graphics when you're doing that, because you don't need to have everything just sort of like in words. But what I was really great to see was your reflections of your leadership, of what you've learned. And, you know, I hate to use the word, but it's that leadership experience or journey, dare I mention. I do sometimes think journey word's a bit overused, but it is that. So some of the things, what I really loved that I've pulled out specifically is thinking around quality improvement, how it links to your leadership style. So really thinking of how it integrates. I love the fact that people talked about inspiring a vision and really getting sort of at different levels and getting people to work together. Gemma mentioned this word already, and it's one of my favorite words, being tenacious, tenacity. And I saw that a lot in what you were saying with your leadership. So you were saying it's important to remember to focus on the task, and really not get sidetracked and not becoming disheartened, because you do knock on a lot of doors, and that sort of inertia can be really frustrating, which a lot of you sort of did mention. There needs to be patience. You can't always go at breakneck speed. You might be. That's always been one of my challenges. I always want to run before I can walk, and suddenly, oops, where have I left everybody? I've got too carried away. So it's really trying to think, okay, how can we go at a speed, not at snail's pace, because you don't want to be stopping. How can you really keep going forward? So I think that was something that really came out from some of your learning, was saying, okay, you have to take it not at not at breakneck speed. The importance of networking, and I think Gemma highlighted this already. That's really important. You've got a whole new network of people, and if you do come on the frontline program as well, or others, you'll get even more of a network. And it's just great. People's different ideas and different views can make such an important impact on you. Also accepting, like we talked about, not narrowing down the amount of solutions to your particular, what you want to do, your aim. And what came through was you were saying that you tried lots of different solutions and the teams came up with other solutions, which is great. So being open to those ideas. And I love it when you sort of think, oh God, yeah, that's a great idea. I hadn't thought of that one. It engages your team and keeps them really motivated. Incremental improvements. Rome wasn't built in a day, so thinking around how you do those step by step, and sort of dealing with change. We know some people don't cope with change very well, so I think it's just thinking some of those things through. Problem solving, that came up a lot. You like to problem solve. I think that's a nursing trait. We all love to problem solve, don't we? Give us a problem, we love to sort it out. Leading innovation, so actually being at that edge, not being a follower, being a leader, really taking forward, which was great. And planning and delegation, that came through quite a lot, thinking, how do we delegate? It's a real skill. It's tough because sometimes, if you're like most people, I'll just do it myself. So actually hearing that you're really trying to do delegation is absolutely great as a leadership skill. Building trust and respect, that's really, really important. And it's quite hard because it takes a long time to build it, but the minute you do something wrong, it's back to zero. So really trying to think how you build that trust and respect, which is what you were talking about. It was great to hear, and I'd love to hear more about how people did this, because again, I think you were very good. You did prick my curiosity with a lot of the things you wrote, and I'm thinking, oh, I want to know more about that. But we decided that, it was going to be, we needed to make it sort of succinct. So where you talked about motivating and encouraging colleagues, love to know more about how you did that, because I think that's always something that we need to learn about. Effective communication, came up with quite a few ideas of how to communicate with different people, using different ways, you were highlighting using different meetings that were already there, face-to-face, emails, just thinking of mixing it up. And another one that jumped out, improved time management. Well, we can always improve that. What we also saw very much was increased confidence. So increasing confidence in teaching, somebody said, and just really thinking about improving mentoring, coaching skills to junior staff. So that's really showing amazing leadership qualities. I think, as I said, collaborating with others and working as part of the multidisciplinary team came out really strongly, and the whole emphasis of really improving patient care. And sort of taking the lead, being proactive, and I think also to be the host and not be the hero. I thought that was quite an interesting comment. I'd love to know more about what you mean by not being a hero. And facilitating and empowering others and improving their morale. And what I think you probably learned through this course is looking at, and this is again very important through when we're thinking about quality improvement, you're feeding back, and you had a go at that, feeding back around the aim statement, encouraging constructive feedback. How you feed back to somebody can really, really make a big difference. Learning together was one thing that came out, and I think we could just continue to learn, which is really, really important. And sometimes there are those delays. We've had so many things going on and with outcomes, and I think it was saying that other departments might not see it as a priority. So being patient and finding ways to encourage them it comes up the priority list is really important. Wear them down with your enthusiasm. That's what I would always say, is much better than moaning all the time. And I think also taking on board people's concerns. Again, when you're looking at change, when you're looking at quality improvement, taking people's concerns, thinking what they're concerned about, because they, you know, it's important you listen. You might think, oh gosh, I hadn't thought about that. So that was really important. And just take things a step at a time. And what I really liked was a couple of people said, celebrate success and celebrate progress, like we're doing today, which is great. So next steps, as you probably know, I can talk forever, but I'm nearly finished, so you're all right. So I think what I would say is that this is only the start of your leadership experience, journey, whatever you want to call it. It's really about using QI to help you improve and move forward. You've got great networks already, so you can really gain and learn support from that. And QI, I think the important thing for me is it's systematic. You follow a process, you do that, so it's systematic, because we can all go over and do the butterfly, but systematic is really, really important. Know what you know, so to be open to ideas and make sure that, you know, think about how you're going to get your ideas to stick. So thinking around sustainability. So what I would say is keep measuring, and in the spirit of curiosity, so know how many things work, spot the problems early and address them. You can demonstrate to others the impact you've had and respond rather than react to queries, concerns or targets. So proactive planning, use all the tools that are available to you, share your resources or ideas that you'll find and work with others, use measurement to monitor, control and communicate the quality of what you're doing, keep measuring over time, ask, improving. So that's really what I would say. Keep improving, take on everything, enjoy being, I really am looking forward to enjoying watching your careers go forward as a leader. And I think most of you have got my contact details. So if there's anything I can help you with, please let me know. And I'm really looking forward to hearing the presentations. Even though we've read them all, I'm looking forward to bringing those presentations alive of the projects that we're going to hear about. So thank you very much, and lovely to see you all again.
Thank you, Claire. That's brilliant. I think what I heard there from Claire is somebody that looked over all of those abstracts, and as she said, Joe from the F&F looked at them independently and they scored them. Actually, every single person in the cohort could have been selected to present today. The quality and the caliber was outstanding. So anybody that says that leadership is about a job title that has manager in it or director in it, I would really challenge that. What I see in these abstracts and amongst your cohorts is that leadership is about influence, and it's much more about how you get engaged with people, help them to understand the value of your ideas, and as Claire said, using evidence to underpin that is where the influence and where the leadership comes from. So to every single one of you, huge well done. But we did have to select the top 5, and we're going to hear from that top 5 now. And we've got some presentations from each person that was selected there. And I'm going to ask Harshal to share her screen. She's got your posters there to show as you're presenting. That's okay, Harshal? Okay, so if we move the slides on, Harshal, to the first presenter, which is Darren. Sorry to give you a shock there, Darren.
That's all right.
Attention.
That's all right.
Here we are. So here's Darren. So for all of our presenters, we have about 10 minutes each to listen to a bit more information about your projects. A bit like Claire said, hear more about the relational, the challenges, those types of things, and then we'll have opportunity for some questions as well. So whenever you're ready, Darren, over to you.
Yeah, I'm ready. I'm ready now. I mean, firstly, an apology, because I've been working nights for the last 4 nights, and this is my first sort of day, really. So I didn't really have time to do a full presentation. So I'll speak to the poster, really. I probably, to start, I mean, when I started on my ward at the beginning of the pandemic, so it's literally the 23rd of March. And so it's been, you know, it's an interesting time to come. And I think some people know that my background before getting into nursing is primarily IT. So I'm always interested in, you know, problems and how we can be more effective and efficient in what we do. And normally it's predominantly for a sort of an IT lens, oftentimes for me. And to be quite honest, I was sort of horrified at some of the duplication, the wastage, and some of the time where nursing staff, and we all know, you know, how valuable nursing time is, and how they were pinned down really, doing work that was duplicated and unnecessary. And I saw that there was an opportunity to use the tools better really, and more effectively. That we have. So there were two elements really to my proposal, and one was around the EPR. So this is electronic patient record system that we use, and we're all familiar with, you know, doing daily nursing notes, those kinds of things. The way the system is used at where I work is it's used in a kind of an unstructured way. So there's not always a complete consistency in terms of the way that people add their notes onto the system. So that was the first part of it, and the second part was really around the daily handovers between shifts. So, you know, like the 12-hour shifts, they would also provide like a written handover, which was good in one way, but it really used to take nursing staff hours in some cases to do that. And that was something that was able to measure really. And there was an awful lot of frustration from nursing staff around that, because obviously they were, you know, if there were incidents or pressures, and obviously taking nursing staff away from patient care. So I saw opportunity to really be a bit smarter about the repurposing information that we had in the system. I was able to speak with one of the nurse consultants that I know that I used to work with, and I said, look, you know, these are some of the pressures that I see and some of the opportunities really to move forward and improve things. And so she suggested to me to write a paper, like a proposal to our CDS. So that's like it's a directorate within the trust, so a departmental level, I guess. And that's what I did. And that was quite useful, because she said put it on one page, and that's what I did, and that enabled me to get clear about what I was thinking about, you know, what were the benefits, what were the opportunities, and just to be very clear and succinct, and that's what I tried to do. And as a result of that, some more senior people got to see that, and there was a dialogue opened up, and as I think as Claire said, that took some time. You know, knocking on doors, and it was I can be quite impatient really, and just want to, you know, and I can't, and so there's lots of learning opportunities for me, but it was around, you know, explaining my perspective, getting people's input, both senior people or people that were leading QI within the organisation as well. So I got an opportunity to talk to the QI leadership. The chap that actually led on that in the organisation. It took a while because he's a very busy man, and also the team that improved the actual EPR, the electronic patient record system. So they have like a service improvement team. So I got to speak to them, and also, you know, some of it was quite humbling, because then you realise what are the limitations, what are some of the hard stops that you're up against as well. So there's the reality aspect. And so they were all really good points of learning for me, and also speaking with the staff. So some of it was obvious around some of the improvements we could make and some of the wastage that was there. But one of my actual ideas that I presented, that I proposed within this was around the structured note and the opportunity that you could use that for like repurposing information, audit, all kinds of other benefits, and search. And that actually idea came out whilst talking about my initial idea with one of my colleagues, and so that made a lot of sense. And so that evolved my thinking really. In a way, that was kind of really her idea. I'd thought about that before, but when I spoke with her, you know, she was a very, very smart woman, and it made an awful lot of sense. So that really changed the way that I move forward with this really logically. Now, to be perfectly honest, how this turned out wasn't really the fancy electronic solution that I'd initially envisaged. I mean, really, they changed the way that the the written documentation, the written handover that was generated, and this was the main piece of work that was taking a lot of time. That was actually dropped in favour of a more practical written note. But I think the important thing was the demonstration of an acceptance to some extent that we could change the way that we were using the electronic tools. One was, there was a lot of room for improvement, and two, the fact that we could do that, and the fact that there was understanding and enthusiasm from the ground up to do that, really. And the fact that there was change, because sometimes within, say, the nursing team, there can be people can be a little bit cynical about, oh, can we change things? Is, this is what we do. We don't understand why we're doing it. And it took a while, but there was change, and there's definitely an opportunity to improve, obviously, a whole range of systems, but certainly the way that we use information. And I think that's really, really exciting and important, because nursing, from what I can see, is increasingly does get encumbered with a lot of bureaucracy and paperwork, and some of that's necessary, but I think we need to be smart about the way that we utilize that, really. So I think I've waffled on quite a bit there in my sort of bleary, half asleep mode, but that, I don't know if that sort of paint a little bit of a picture of some of the challenges and some of the steps that I went through, really. And something that Claire mentioned, which I put in my in my poster, was really about quick wins and incremental change as well. And there's part of me that's, I'm quite, that's quite a hard lesson for me, really, because I normally want the sort of grand thing that I have in my mind. That's the way it should be, and of course in the real world it's often not like that. So the small incremental improvements and steps, and some of the work that I think that I've done, I've been involved with my colleagues, is sort of foundationary work to say, well, there are other changes and acceptance that we can make further changes moving forward. I think that's probably the most important thing, really. So
thank you, Darren. Fantastic. Darren, Radha would be proud. That was really engaging and felt like I went on a journey. And I know that Claire said the journey, that it's a bit cliche, isn't it? But I felt like we followed through your journey there, totally engaged, and I could see the rest of the audience were as well. So fantastic presentation. Thank you. We're going to open up for some questions now. I saw Chris's hand pop up there. Did you want to ask a question, Chris?
Sorry, no, I was just clapping.
Oh, wow. Well, would you like to ask a question?
Oh, you put me on the spot now. Just did you liaise with the team quite a bit before you settled down with what it was that you were doing, Darren?
Yeah, well, what happened, Chris, was it became apparent. It was pretty obvious early on that what we were doing was wasteful. There was a lot of duplication, and you could hear people's frustrations in the office. And then I sat down and said to people, look, I'm on this program. There's an opportunity to change things, and try to convince them that we could change things. And then we were able to establish how much actual time they were spending on these things, and a little bit more, paint out the details of where time was being hemorrhaged and opportunities for improvement, and what they were being taken away from as a result of the time they were spending on this. And then it all poured out of people, really. So then I knew I was onto something, really. I already kind of knew that I was, but it was very clear that the nurses and the charge nurses were really sort of infused by that, the opportunity that we could change it. And I said, look, I'm sure we can. I think we really can. And I said, I don't give up easily. I'll keep, if I think that I'm right, I will keep on, basically.
Yeah.
That tenacity there again, isn't it? That trait, I think, is, again, it's a real key feature, I think, of a successful leader. Any other questions? Claire, you are allowed to ask questions I bet you have questions.
Well, I was going to ask sort of how have you progressed since you submitted the poster, because I know you had quite a few next steps.
Yeah, well, the QI one really. I mean, we've been hit really hard by COVID. It took out 85% of our clinical workforce. Me, all our patients got it. One was on a ventilator and nearly died, and had come out of hospital today. So we had 2 people. So it's been very, very difficult time. But on the positive side, there's an agreement. I'm going to do the silvered QI training. So that's probably been delayed a little bit as a result of COVID. That's why I mentioned that. And I've been accepted onto a postgraduate diploma in mental health, which I start in September. So I'm going to see whether I can shake some money from the trust to help partly fund that. But that's sort of work in work in progress. But never, whatever happens, I'm going to do. I'm going to be on that course. So that's really important. And also sort of engaged. Again, I contacted the director that leads for digital and on the trust about a separate area, and also flagging up that I was quite happy to get involved in piloting. This is some other ideas that I've got as well. So I'll keep on. I will keep. Treading that path really, and hopefully become more, a spokesperson if I can, and try and embed myself more in working groups and things like that moving forward. So we'll see how that goes. So that's still work in progress, really.
But that's fantastic, because it's really showing how you're going to use your influence, because you're getting into the different ways. That's just great. Hopefully you will get some money. I'm sure there's different, I'm sure there's other ideas of where you can maybe get some funding from. I'm sure Gemma might have a few ideas.
Yeah,
not
helpful.
Absolutely. And as I was listening to you, Darren, I think one of the often the unique features of nursing associates is the added value of the careers that people have had prior to coming into this profession. And it sounds like you're really starting to fuse those your past history and experience with your knowledge and how that can apply to this particular context. So your organisation are incredibly lucky to have you. And I hope that you do get those platforms, and we would love to help you to take that agenda forward. It's the digital leadership is something that we're really focused on at F&F, so we'd love to help you. Yeah,
that would be great, because I'm really keen to keep abreast of what's going on in that space as well. I'm really, really excited about participating in that, really.
Absolutely. Thanks ever so much, Darren. You've got us off to a brilliant start. Thank you.
Thank you.
So we'll move now on to our next presenter. Oh, you got a round of applause there from Chris. I think we should, even though we're all on mute, we should do a round of applause, shouldn't we? So our next presenter is Magda.
Hello.
Whenever you're ready, Magda, the floor is yours.
Okay. Well done, Darren. I don't know. Your project is on a big scale. So my project was completely different to yours. I looked into, so I work for the Community Older Adults Mental Health team, and I looked since I qualified, I started working a little bit more with patients who are on antipsychotic medication, having those skills like having able to take in the blood tests and helping mental health practitioners in the team to complete those antipsychotic checks on patient. I thought, let's have a look at it, and I've noticed that in our team, because the antipsychotic checks, they are supposed to be done in a timely manner for the patients to make sure that they are tolerating medication and they are safe for them to use this medication. I've noticed that those checks were not done on time, and I didn't know why it was, what was the reason for that. So my plan was to improve the completion of antipsychotic reviews to improve the patient care. First step, I spoke to my team members and my colleagues, and they said it's a great idea, and they were up for it. So I completed questionnaire, which I sent it via email, because at the moment, unfortunately, most of us, we are working from home. So sent the email to them with the question and asking them what their suggestion is, why it is happening that antipsychotic checks are not done on time, what is the reason. Over 90% of mental health practitioners emailed me back, so the response to that was great, and they came up with lovely suggestions and ideas. The all data was put together and analyzed, and 3 main ideas and suggestions were chosen. So first of all, the plan was to have an in-house training with one of our consultants who will be able to go and let us know and other team to know how to complete the antipsychotic checks and why this is important. The second suggestion was to nominate one person from our team to be antipsychotic champion, to help with the mental health practitioners and support mental health practitioners in completing those checks. And the third suggestion was to formulate step-by-step guide where can be put in community files, and where all the members will be able to access it easily. It was a little bit challenging because, of course, as we all were dealing with the COVID, and the increase of patients coming to the community was a huge amount. So and getting together people. So the acknowledge was to have an in-house training first. So we managed to speak to one of the consultants who agreed to do the training for us, and the over 80% of the team who are dealing with antipsychotic checks attended the meeting, which was again very successful. They were able to ask lots of questions. The consultant was answering. Also, we nominated one person who was antipsychotic champion, and the suggestion and the idea was for the champion to work closely with mental health practitioners and support them in completing those checks. Step-by-step guide was put in place, and it's in the community files where all the new members, especially new members, and can access it easily. And all information about antipsychotic medication is there, and how to do the reviews, especially with this older age group. So that was implemented, which was a great achievement, and we've done it pretty much in a good time scale. I think within 3 months' time, we've noticed that there is much improvement in completing those antipsychotic checks on time. I had a feedback from antipsychotic champion who was advising me that he started sending weekly reminder to mental health practitioners, to just letting them know when the antipsychotic checks are due. And he's got a spreadsheet with all the dates and prompts. So that's working really good. There's a good communication between mental health practitioners and antipsychotic checks champion. Also, the improvement in patients' care is there as well, because the checks are done in a timely manner now. So in terms of medication monitoring, tolerance of medication, it's a great achievement as well. So what we've learned from that we as a team gave different ideas, suggestions, and that encouraged everyone to put something in place. And as a team, we came up with this solution, like in-house training, antipsychotic champions, and supporting each other. And this is, of course, ongoing, because we've got a lot of people on antipsychotic medication, and they need antipsychotic reviews. So this is ongoing, and it's working very well. It's a success.
Wonderful. Thank you so much, Magda. Really fascinating. Yeah, round of applause for Magda. So some questions from your group, Magda. Anybody would like to ask a question? Give me a wave, either a Zoom wave or a physical wave. Darren.
Hi, Magda. I thought that was excellent. That was really, really good. An excellent piece of work. I mean, what was the feedback from the patients themselves?
So most of our patients, majority of our patients, they do have diagnosis of dementia. So we as much as possible, we can communicate with them and having feedback and communication with them. But also we are working very closely with family members and carers. So we've got this communication with them, and the feedback was that we were able to arrange the antipsychotic checks, which involve blood tests, checking the vital orbs and things like that. And for them, having know that this is due, they know that we are coming and doing the checks, that we are looking into the medication, because of course the antipsychotic medication in older adults, they're with the high risk we are giving them, and there's lots of high risks and side effects of that. So we need to closely monitor that. So for them, it's reassurance that it's everything up to date, and we are monitoring and the tolerance of the medication. So
Yeah.
so I think that's the reassurance for family members and patients as well.
Yeah, no, that makes sense. No, that's great. Brilliant.
Thank you. Good question, Darren. Any other questions? Claire?
It's a bit of a comment as well, but I think what your project, and I think it's a great project, is going to be a real example of ongoing, because you've really showed that wonderful team working, and I think it's lovely that you just showed you were open to all those ideas. So I don't know whether, from just feedback, has it helped the team? Do you think you're going to do other, look at other areas because of that great team working that you demonstrated there?
So it helped greatly, and I think this project around antipsychotic, it's still ongoing, because we are still getting new staff members, so we need to train them, we need to go through with them. I think it gives other ideas to do a little project. Prior to my project, there was another project done around duty task and how the duty is done within our team. So we look into a little project within our team, how to improve the care for the patient and how to improve our working together as a team. So hopefully that will give other people some ideas if they want to improve something.
I think it's absolutely great, because you've really incorporated it into your work. So it's absolutely brilliant. You're doing really great job.
Okay.
Thanks, Claire. Thanks, Magda. And I was, as I was listening to you there, Magda, it's almost like that kind of ripple effect of these changes. As you say, other people will see that small changes have big impact, and they may feel like something that is common sense, or it's the way that we've always done it, so why should we change it? Those kinds of things. But actually what you've shown is that by making small changes, we can have great impact, and that ultimately all of the people who use our services will benefit from that. So brilliant. Ripple effect, I think, is what I'll call that one, Magda. Thank you so much.
Thank you.
Thank you. Well done. So Chris is our next presenter.
Hello.
Over to you, Chris.
Thank you very much. Well, initially, a bit of background really. I work for a community mental health team called Early Intervention in Psychosis, and we're predominantly dealing with people who've experienced a first episode in psychosis. Initially, excuse me, like a lot of the group, I went to something that I'm interested in and something I'm kind of leading in anyway, which was physical health. But in consultation with my team leader and the rest of the team, it was thought that as part of our treatment, we offer family interventions to people. Now, we've recently been audited, and even though our uptake for family interventions was slightly above the national average, we were still quite low. It was around 29% of people that actually agree to these family interventions. So the family interventions, as a team, as a model of care, I suppose, really, we take a holistic approach to treatment. So it's not just about treating the individual and the symptoms, but it's about looking at their housing, their vocational, their future, and also their family. And obviously family in itself might might be the best word, because it might not actually be a standard family. So we think it could be a caregiver, it could be friends, it could be family, that kind of thing. So I looked at that. I think, you know, I had the answer going around my head of if it's too big, maybe it is too big. And I think the audit, you know, seemed to reflect that the physical health stuff was actually quite good. So to maybe focus on something that's probably less well represented. So I decided to do family interventions, which was good for me because it was something I could learn more about myself, really. So I think we approached it we do have regular meetings monthly about family interventions, but we decided to have a more in-team, more in-depth approach to that, where people who were interested in not only learning more about family interventions, but maybe learning from others as well. So it was really exploring why the uptake was so low for family interventions. I think we went in there kind of maybe thinking why it might be, but I won't bore you for too long about that. But I think we went in, we come to the conclusion quite early on that it was both sides. I think families weren't that keen on the idea of having family interventions for numerous reasons. They may have thought it was like, well, we're not the problem, the client, the patient is the problem. They don't want to really have the idea of family interventions kind of as a connotation of it'll be slinging mud around and it'll be a blame culture kind of thing. So a lot of it was about myth busting, I think, a lot of the time. And also, I think from a staff point of view, there was a lot of confusion around staff about what it actually was. So I think, you know, kind of unconsciously, we probably weren't selling it. We weren't encouraging people to engage in family interventions quite as much as we should, because there was a lot of confusion on our side. And I don't think we really pushed for what it was. I think it's easy to fall into the kind of idea that these family interventions with people with problems, like problem families, or where there's friction in the family, that isn't the case. So I think that was one of the biggest myths that we had to get over, really, was this is for people who are actually doing okay as well. You know, it's more of an environment, it's more of a place for people to reflect on things, to basically communicate better. We're not really about solving any problems. There's a quote on the poster which I thought was quite good, which I didn't come up with, by the way, which is, you know, the person isn't the problem is the problem. And I think that was kind of quite apt, really, is like, let's move away from problems and just kind of get to communicating better. There's evidence to suggest that, you know, if people have better support and better understanding of their mental health, it leads to better outcomes. In the end, it leads to better recovery times and general recovery. And I think that's the same for families as well. I think you have to put yourself, you know, you have to take an empathic approach and put yourself in a family's position and think, I've got a loved one or someone who's just either recently become extremely unwell or has really changed in some way. So I think a lot of the time, a lot of services focus on, you know, the patient's understanding of the problems, but in actual fact, I think it's really important that families also understand what's going on. And it's okay to not know what's going on. It's okay to be worried. It's okay to have a place to kind of really discuss these things. So I think we looked at how we encourage or how we sell the family interventions, really, and it was seen as it was very kind of just informally mentioned, would you like family interventions? And because families didn't know what it was, staff didn't really know what it was, it was never really kind of explained to people what it was about, what the goal was, and what it would actually look like. So we were looking at ways of improving that, really. Obviously there's a leaflet in the post there, which I don't really think is probably the best way of doing things, because you hand people leaflets when they've just been in a session or into an appointment, and we do what we always do with leaflets: stick them in our bag, we recycle them, we don't read them. You know what I mean? We very much live in a world these days where, you know, almost the written media's, if it's unless it's very concise and quite small, people don't read it. You know what I mean? I think that's just a general the way things are. So we have to improve on that. I think words used as well, as I mentioned before, the word family has certain connotations. I don't really think that's ideal. The word intervention isn't really perfect either, because that seems quite a clinical and quite a stuffy and, you know, quite a loaded word to use. So we were looking at the language used as well. And I think taking like quite a contemporary approach to things, really, like working on from the written media thing, is maybe looking at more of a multimedia approach, maybe looking at more maybe videos, short videos, something maybe quite concise, maybe something quite humorous as well. You know, let's not make this too stiff and too boring and too, you know, too worrying for people, but to actually just make it, show it what it is, and not make it out to be something that it isn't, which is really intense and really in depth, and it's going to you know, stir up a lot of trouble within families. It's going to be people talking, essentially, you know, and trying to capture that feedback from, you know, families that hadn't taken up the offer of family interventions, but also why staff weren't maybe encouraging people to do it quite so much. So we could, you know, we've done a questionnaire, we could send that out to both people that engaged in it and people that hadn't taken it, and staff also. You know, the impact of that could be that it's a really benefit. I personally think it's a really beneficial kind of treatment that can be offered, and I think, you know, if we looking at the statistics, as I said before, our uptake was 29% of our caseloads had actually agreed to it, when the national average is only 21%. So I was kind of trying to explore, what is it about that? What is it about the family interventions nationally that really, you know, what are the problems? Why don't people really want to do that? And I do think it's all down to confusion, really, and myth busting, and people not really understanding what it actually is. You know, there's good evidence to suggest that this really helps people recover as well. Sorry, I wrote a few notes, so I'm just having a little look at my notes while I do it.
That's fine.
Yeah, I think it's, you know, about sharing ideas and experiences, really. You know, I think speaking to staff, speaking to other teams, speaking with families that are involved in it or not involved in it, and the patients as well. I think a lot of people just kind of shut up shop when they hear this kind of, no, it's not for us, we don't need to do this. So it's about exploring why people don't want to do it, and maybe trying to encourage them to do it and look at the benefits of it, really. With regard to next steps, you know, there's quite a lot, to be fair, because, you know, a lot of this is, as we say, it's ongoing, it's a work in progress. I think it will be, I think me personally, looking at trying to redesign a leaflet and redesign, or kind of film some kind of TikTok style videos, is that it's quite an art in itself, really, you know. And I think, you know, graphic design is something that we take for granted, but in actual fact, it is an art, and to get your point across in such a good way is, you probably need the support. So I have approached the trust to kind of help us, the comms department, to try and help us with some of them things, really. I think potentially we'd share these ideas with, you know, the EIP network in itself, really, to see if we could kind of improve that on a national scale. And just to continue to capture feedback, not just kind of, you know, as and when, but as an ongoing thing, you know, to continually be redressing it, to be an item and in the agenda, on the weekly or monthly agenda, to say, like, how are we getting on with family interventions? Have we had any good feedback? Have we had any bad feedback? And that kind of thing, really. So I hope I didn't waffle too much and that made sense. Has anyone got any questions?
Absolutely, Chris. Brilliant. Thank you. I'll tell you what, I've got a story about some family work I did a few years ago. There was a family where the situation was getting really breaking down, lots of angry outbursts, and the mum was saying she didn't feel safe in the house. It was getting towards crisis point, and we did some family work and tried to get to the bottom of what was triggering these angry responses. And it turns out the chap who was the mental health service user would get up in the middle of the night and make himself some toast and leave the crumbs and the butter out. And so every morning his mum would wake up to a kitchen that was clean, then in a mess, and some butter that was no good. And it set the whole day off in this angry tone where they were both really annoyed with each other right from the get-go. Neither could really understand why, and it escalated as the day went on. So with a bit of family work, we managed to work out that if you wipe up your crumbs and put your butter back in the fridge, and they've solved a major violence and aggression safeguarding issue. So I'm right there with you, Chris. It is about opening up communication channels that sometimes the family themselves can't do for themselves. So
absolutely,
yeah, brilliant stuff.
I mean, a lot of the time it can be trivial things, can't it, really,
Yeah.
that kind of just, you know, set things off. And, you know, families don't often communicate like they should, and certainly families who have got maybe somebody with a newly you know, a person with a new kind of condition going on, that's potentially have changed who they were as a person at that time. So they treat them with kid gloves, and you know, we avoid friction. But, you know, if you can approach it in a positive way, it can have such, you know, profound effects, really.
It really can. It really can. And again, back to those small changes having really big impact. Anybody else got questions or comments? Darren?
Yeah, I thought that was great, Chris. Thanks for that. And one of the things that I found interesting was about, you were saying that there was sort of confusion within the service, you know, from the staff side. I mean, that was one aspect of it. And perhaps that people, well, what I read from that people weren't conveying perhaps the confidence or whatever. And I think that's a really, really strong point, and a point that I see I see that a lot in healthcare, you know, where people aren't confident. And that is a really good point. I think you got there. I don't know if there's anything else around, and maybe we was reticence, I guess, from the from the service user side as well. I guess, was there around what it
Definitely.
was as well.
Definitely both. I think it was both, but I think it was actually almost kind of embedded in staff. I think we were the problem in many ways. I mean, I don't expect people to, you know, this is a voluntary, you know, people don't have to do these things, but I don't think we were given the intention it deserved, because we weren't sure. You know, we really weren't sure. And I think nobody likes to deal with, you know, with conflict resolution, aren't we? And I think if you add in a few other family members, you know, and a potentially volatile situation, a lot of misunderstanding, a lot of preconceptions about stuff.
Yes.
You know, it could be potentially a really, you know, difficult situation. So I think that was the issue, really. I think people and staff, everyone just said, family interventions, not for us. No, thank you. Sounds really difficult. Sounds really challenging. We're okay. Do you know what I mean? This person is, you know, being treated now. We're happy with that. Let's leave it there. So I think it was about that, really, you know, and myself included. I think we go for problems, don't we? We problem solvers, was mentioned earlier, but it doesn't always have to be about solving problems. It can be improving situations that are already okay or are already managing quite well. Why not go for like making even better improvements? So I think working on that as well, when you can do that, you can then move that on to somebody who maybe has got problems and that you need to address them in a certain kind of way.
And just finally, I thought also the point that you made about sort of presentation and communication, you know, about the printed word and the videos and how important all of that is as well, you know, increasingly, and especially amongst a certain demographic as well, you know, which is the demographic that you're working in, isn't it? Certainly on the service user side, it's early intervention. It's, you know, that's a really good point as well.
I think the good thing about that came from that as well was that, you know, we are in the process of kind of doing a Facebook page, and it was seen as that could be a really good kind of thing for that, is to post the videos onto the new Facebook page, but also other treatments that we offer, like CBT therapy, you know, the physical health stuff, just really getting into that really kind of, you know, modern way of information sharing, which I think for whatever reason we neglected, really, because maybe we don't have as much service user involvement as we should, and maybe we missed that, really. But I think now we've started to acknowledge, you know, we do need to move with the times a little bit, really.
Yeah, that's cool, Chris. Yeah, really cool.
Really good, really good. And I saw Naomi giving me a wave there as well. Did you have a question, Naomi?
No, it's more about sort of comment, and just you know, I'm impressed, really. There's a huge amount that can be said about the language used across the board within our profession, I think, because there is always such a kind of, people do react rather than respond, and that's what we have to be careful about, I think. And also a lot of our service users and things can't access the communication through written word anyway, because they've had poor experiences and illiteracy and dyslexia and things like that, just make it inaccessible anyway. So we have to change if we want the service user involvement, I think.
Agreed. Yeah, I think that's what this project's been really good about, is kind of, you know, framing things really and looking at things that you maybe just assumed that's just the way it is. Do you know what I mean? But actually to put it under the microscope and kind of explore it a little bit more, and then it moves on to other things. Now you think, oh well, yeah, we're doing it in family interventions. Why aren't we doing that with CBT? Why aren't we doing with this? And why aren't we doing it with that? And I think it's that kind of that journey. You know, I think that's what's been really valuable for me. Really, is thinking that maybe not just about this family intervention project, but as a service in totally, how can we better, you know, better communicate?
Yeah, absolutely. Oh, and Claire, but just final question from Claire.
It's really more a comment. I just think I love the way you're challenging the language, because I think we do professionalize it. And I think, like saying family intervention, it's great working with users to act, you know, sort of your end users to think, okay, what language would be much more appropriate? Because we just professionalize it all, and that's an immediate barrier, isn't it? So I think I love the way that you're you know, thinking, okay, so how can we challenge this language to make it more accessible? Never mind how, it's the language to start with, which people go, I don't want intervention, because your immediate reaction, isn't it? But it's thinking what else. So I think it's just really interesting, that language. I could talk about that all day because I'm fascinated by it. So thank you. I think it's really interesting, and another brilliant example of moving forward and thinking how, you know, it's only sort of halfway, not even halfway through yet. There's lots to do.
Absolutely. Thank you.
Yeah, 100%, Chris. Now I always think about that, those languages that we use around people who are difficult to engage, you know, or sabotage engagement, those types of things. And I think, well, how challenging what is it for them to understand the language that we're using and have a motivation to want to engage with that type of a way of working. So I think there's huge mileage in this, Chris. I would love to support you going further with it, and any help that you need in terms of writing this up, because it's some really innovative work that you should be sharing once you start to gather that and get it out there to other areas.
There's a journal article in it somewhere.
I'll take you up on that.
Definitely. I agree.
I think we've got lots of journal articles from a lot of you, actually.
Yeah, 100%. Well, I've spotted that Tony's now been able to join us, but I know Tony is joining us from clinic. So Tony, could I ask you, are you able to present, Tony, or is it too tricky?
It's a bit tricky at the moment. I can try in a few minutes to present, but yeah, I can actually, I could do it. I can make a quick one actually.
Okay, well, over to you then. Over to you, Tony. You do what you can.
Okay, all right, just well done.
I keep spotting Tony being on the move. I kept seeing it in my camera.
Yeah, so I think mine was about physical health. Yeah, and I just need to pull up the poster that I did actually.
We can see your poster, Tony.
Yeah. Yeah. So I think the main it was about improving physical health for people with mental health illnesses in community mental health services. That was my topic, and yeah. So I don't know where to start. I didn't listen to what other people were saying, so I'm not too sure like what you actually meant to be saying, or just reading out like my my poster. Is that right?
Yeah, just a bit about what you did, Tony, and what you learned, really, I guess, is the key things, the impact that it had on your services, but also on yourself.
Yeah, so I guess with my one, one of the things that I was trying to capture was the people, obviously quite a lot of people with mental health, they get neglected in terms of like with their physical health, ignoring or themselves like not understanding their own physical health. So it was sort of like an education to them while what I was trying to do, education to their physical health and how to report in terms of like the nursing associates, for example, or the nurses that are available on the ground, to be able to do certain sort of like we avoid things like NE admission because we know how much like quite a lot of people go to A&Es in terms of their physical health, and something that could be dealt with. So I guess like the approach was like trying to implement regular checkup for patients with mental health illnesses to improve physical health and supporting them at home.
Tony, sorry to interrupt.
To reduce like hospital.
Tony, I'm really sorry to interrupt.
And
Tony, can you hear me?
yeah, I can hear you.
I'm really sorry. Your sound's not very clear. We're only picking up very small amounts of what you're able to share. But what I'll suggest, Tony, is if we can all see your poster, and what we'll do if everybody's happy is we'll share all of the group's posters around, so you can all read about each other's work and help you to connect if there are areas of similar practice, if that's okay.
Yeah, I don't know if you can hear me a lot clearer now.
Oh, it's better now. Yeah, do you want to give it another go?
Yeah, I can try and give it another go. I don't know, my laptop just turned off now. So as I was saying, that my main aim was sort of like talking about the implementation of like physical health within like community. So in the community, so we have like issues with quite a lot of like patients being admitted into A&E because of their physical health, and like it's something that could be dealt with in the community. However, like, you know, some nurses, if you're a mental health nurse, for example, they just automatically assume that you cannot help patients with their physical health. Why? Because of, you know, we only deal with mental health. However, what I was trying to do is an education.
No, I'm really sorry. I'm really sorry, Tony. We've lost you again.
Patients, both patients, all we could do basic observations. You lost me again.
Yeah, I'm really sorry. I don't think it's gonna work this time, Tony.
Okay.
I'm so sorry.
It's all right.
But thank you for making the effort to, and thanks for joining us from work as well. That's multitasking at its finest.
Trying.
Thank you so much, and thanks to all of our presenters today, and congratulations to you all for being selected as the top scoring abstracts. They were, as I said before, the standard in this cohort was consistently high quality. So it really congratulations to you all, but especially to those that were selected. We've heard some really amazing examples of those small changes, big impacts, the ripple effects that this type of way of working can have on culture, because people start to be open to new ideas, and new ideas should come from every person within that multidisciplinary team. You know, often it's the people at the point of care that can provide the intelligence that will really shape an idea into something that makes a big difference. So I think you've given us loads and loads of examples of that, and thank you so much. Now, we're a little bit out of our timings because Valletta's not here and we couldn't hear from Tony. But what I'll suggest we'll do is we'll go into our breakout rooms now. So we would normally we have a guest speaker coming along at 11:30, but we'll delay that person slightly and go into our breakout rooms now. And what we'd like you to do in your breakout rooms is just take some time together to reflect on your experience of being on the F&F programme, and what impact you think it will make moving forward. And when we come back together and we do our awarding of our e-certificates at the end, if you could come back to us with just one word that signifies that experience or impact for you, and we'll edit that out of this recording and send that out to you all, so you've got a bit of a momentum from the programme. So Harshal will now break you off into some small groups. We'll have about 20 minutes to do that, so a good time for some good conversation and reflection, and then we'll bring you back together to hear from our guest speaker, Ellie Gordon. Is that okay with you, Harshal?
Yeah, that's fine, Gemma. That's fine. Just give me a minute. I'll just get them in the rooms now.
Brilliant. Thank you, everyone. See you in 20 minutes.
I need to say bye to everybody. I'm really sorry I can't stay with you because I've got to go to a friend's virtual funeral in about 15-20 minutes. So I'm really sorry I'm not able to join you for the rest of the day. But it's been great, and enjoy the rest of it. And I hope that our paths will cross again soon. So you have my details. If you don't, you can get me through F&F. So enjoy the rest of it. So sorry I can't join you for any longer.
Thanks for coming along, Claire.
Thanks, Claire.
Bye-bye. Thank you, Claire. Bye-bye.
Welcome back, everyone. It's lovely to see you. And whilst you've been gone, we've been joined by some special guests. So what I'd like you to do is just hold on to those reflective thoughts and that word that you identified for us. And we're going to hear a few messages now from some of our guest speakers. So we have here with us Ellie Gordon, and Ellie is the Senior Nurse for Mental Health and Learning Disability at Health Education England. So there's a couple of things we need to say thanks to Ellie for. This whole programme is funded by Health Education England. So it's the relationship we've got with the nursing, the mental health programme team at HEE that means that these kinds of programmes can happen. And the foresight that they had to say, we need a specific programme for mental health nursing associates working in a mental health setting. And the other big thanks I need to say to Ellie is that our guest speaker actually cancelled yesterday, and she stepped in at 8 AM this morning to come and speak to you today. So that just signifies Ellie's commitment and generosity as well. And the way that I work with Ellie is we encounter each other in lots of steering group meetings, and we've both got a real passion for clinical supervision, so we work together on that agenda. But at the Mental Health All England Plan steering group, Ellie chairs that with a colleague at NHS England, and I constantly hear Ellie being able to advocate for the specific contribution of mental health nursing associates. So even though she wasn't our planned guest speaker, she is absolutely in a prime position to tell us a bit about what that national agenda is and some messages to you and how you can get involved. So over to you, Ellie.
So no pressure there at all. What a build up, thank you, gosh. To be honest, it was an easy thing to say yes to, because it's an easy sell to come and say hello and congratulations to you all. Because it's one of those really weird things, because you think in your career, you're never going to see a proper new role. And yet here you are, a really proper, completely new role. And from a selfish point of view, I must admit, again, it's really easy because people like myself and of my generation have kind of long been saying parity of esteem, we're really not getting underneath that issue of people with mental health issues, having physical health needs met. And yet this new role comes along that is this perfect bridge between the two. So like I say, from a selfish point of view, it's really easy to come along and say, I'm so glad you guys exist. Because I just think there's such massive potential to bridge that gap, not only in terms of physical health, but as you can probably tell from my background, this is from the Learning Disability Plan. So I'm regularly having conversations with learning disability nurses about, you mental health nurses are a bit rubbish at learning disability. And he's like, well, that cuts both ways. So again, talking to yourselves as nursing associates, you have all these skill sets already embedded in your training, and you have that brilliant knowledge as well as the children's nursing elements, which means you can start to really break down the barriers that a lot of us have tried to break down, but really kind of struggled with over the years. So I just think there's such potential, for this new professional group, that you can address a lot of the things that we've really struggled with, which are those barriers between the different fields of nursing, where we sit in our little silo and we don't necessarily work well with our colleagues because we're quite negative towards each other sometimes. And I was literally having this conversation with student mental health nurses yesterday about how do we get better at realising actually as a profession, nurses are far better together and work better together. And actually, one of the easiest ways of doing that is with your profession, because you add that, you encapsulate those 4 fields of nursing in a single profession. So I think there's a lot we can learn from yourselves about how can we have better conversations across our 4 fields, because we're not very good at it at the moment, and we have a lot to do and a lot to learn from yourselves about how do we get better at that and how do we blend more as a profession of nurses. So like I say, it's an easy sell to me because I have loads of ideas and loads of ways in which I know you will not only enhance your own profession, because nursing associates are a profession in their own right, and I think there's a lot of work we need to do to reinforce that as much as anything, and I don't think we do enough of that as yet, because you are a profession and you should quite rightly be really proud of that, because you're your own professional group. But also, what can we nick from you? What can we learn from you? And unashamedly, like I say, borrow, steal, lend, whatever we can take from yourselves to help shape ourselves and get ourselves in a better state. Because I think, let's say you encapsulate all 4 fields, you can deliver patient care in ways we can only dream of because of the skill set you come out of your training with. And I just think we've got so much to learn and so much to borrow. And I do think that there will be some of you that quite rightly that say, I want to be an RN. And that is brilliant, because I will take more registered nurses every day of the week. I'm not ashamed to say that. I'll happily expand numbers. But I think there's a lot of pride to be had in those that go, I'm a nursing associate and I'm proud to be a member of that profession as well. So I think whichever route you take, it's an excellent career opportunity. And I do feel certainly with the nursing associate role, because it's still very, very young, there's so much potential and so many ways in which this role can shape and develop and develop its own career pathway. Because at the moment, it feels almost like your career pathways are, well, you can go to RN and you get a career pathway that way. What we've not done very well yet is think, okay, so what career pathway is there for nursing associates? You know, where do you go from here? How do you expand and build on your existing skill set? But also, how do we make sure that we can work with you, that those of you that specialise in mental health, it's brilliant, but how do we make sure you don't lose your physical health skills, your learning disability skills and your children's skills that you've learned in your training that make you this really brilliant profession that cuts across all the various boundaries. So I do think there's real great potential in work to be done together about, you know, how do we develop that career pathway? How do we work with you to make sure that you can retain that great mixture of skills, build on that and expand that and make you the best you can be as a profession in your own right? Because I don't think we've really started to explore that as yet. And I think it feels timely that we still need to start looking at that with yourselves and look at where do we go from here and benefit, like I said, benefit from your mental health settings, which is great. And I do think there's more work we can do with directors of nursing who are in mental health trusts about how can they take better advantage of your roles? Because again, I think you come out of your training, you work in a mental health setting and you're being real trailblazers and you're forging the way. But there's more we can do to help you with that and ease that path for you with directors of nursing so that it's not as hard. It's not as much of an uphill struggle as I'm sure it is sometimes at the minute to really make your mark and prove how brilliant you are. So I think there just feels there's lots we can do with you to help you, to support you. And like I say, from a selfish point of view, of course, the more you go out and say this is an amazing role, the more we attract more people into this role in this profession. So there's always my selfish agenda of that means we get more nursing associate working in mental health and of course learning disabilities. So like I say, it's easier for me to come along and say I'm just really, really chuffed that you've done the course and that you've chosen to specialise in mental health, because I know it'll mean big improvements for patient care, and that's what we're all about at the end of the day, is how do we improve that quality of patient care? And I know you guys absolutely do that every day of the week, because you bring that brilliant range. And I suppose the one last thing for me to say is the Mental Health Act is out for consultation at the moment. I think it's something around like 36 questions. I do apologise because it's not my consultation, but there's 36 questions and a lot of pages of that act to plough through. But even if you get a chance just to dip your toe in and have a bit of a flick through and add some comments, please do, because there seems to be a bit of a myth that the Mental Health Act says mental health nurses will do X, Y, and Z. It actually doesn't. If you read it, not that I sit up at night reading the Act every night or anything, but if you read the Act, it says clinicians. So for me, clinicians is yourselves. So again, it's this Act's changing, and it's been the biggest consultation of the Act in about a decade. Will absolutely impact on yourselves and it will make a difference to your working lives. So now's definitely the chance to have a dip into it and influence it and shape it and make your voices heard, because once it's changed, that's it for a good 10, 20 or so years, and that will shape your day-to-day working practice, be you working on a ward or a community or wherever you work. It will influence and impact on you and impact on your patient care. So definitely get involved, because you are, believe it or not, you're already enshrined in there because you're in that label of clinician. So you're absolutely part and parcel of that act and will be part and parcel of its implementation and rollout when that starts to happen later on in the year. So don't think by any stretch that you're not included, because you very, very much are involved in there and included in it. And it makes it really important that your voices are heard, so that you can help shape it and help shape patient care for the future as well. Like I say, it's not a short read, I'm afraid, but it's just worth having a look and having a flick through and dipping your toe in it. And even if you haven't got a chance to think, you want to consult, it's just worth knowing the direction of travel in terms of Mental Health Act legislation and Mental Health Act provision, which is really trying to shift the focus away from quite a punitive act, really. When you look at it, it's quite harsh in some of its terms, and this is trying to move away from that and move more towards much more person-centered care, giving the person greater autonomy even over their own care, and being able to do directives about, if you're admitted into hospital, how would you like to be cared for and treated. So it's quite a shift away from the current act and a big shift away from the current culture in mental health services. So it's like I say, it's definitely worth a look at if you get a chance to have a read through, and if you can consult, even better, because at the end of the day, you guys are the future. So, this is part of you shaping your own future as much as anything else, and being out there and just starting to, again, do what you're already doing, which is starting to forge the path for the nursing associates that will come behind you and specialise in this area. So, yeah, it's just really exciting for me, because you are so new and you are the future, and it is a brilliant development, and it will make a real positive difference to patient care. Just by virtue of your role existing, you're already making a real difference. And I think from a nursing point of view, you just add so much more, because again, for years, we've all kind of complained that we've lost the time and the capacity to do the therapeutic interventions that many of us came into nursing to do. So now knowing we've got a colleague who we can share that workload with frees up our time to do that more therapeutic interventions, but also means we can benefit from your ability to do physical health care, which people like me that trained donkeys years ago, we didn't have physical health care in our training. So it really is an incredibly complementary role to registered nurses as well. So you're very, very welcome. Just delighted to have you. It's great. I'm going to stop there because I'll just start waffling on and saying how chuffed I am, but it's just, I think it's such a great development.
Thank you, LA.
No problem.
We did a bit of a consultation exercise with this group. It was just a few people that came forward, but one of the themes from that was around the variation in how the nursing associate role is utilised in mental health settings, and then not really being a sort of consistent picture. And I know that's something that you're looking at in the All England plan. Would you mind telling the group a bit more about your work in that area?
Yeah, so a colleague of mine in HE had already started a deep dive before I started my role, looking at the nursing associate role in both mental health and learning disability services. And surprise, surprise, found exactly what you're all saying, which is everywhere you go is different. Trust policies are different. Some trust policies will say only the registered nurse can review seclusion, for example, or something like that, whereas a different trust policy will say something different. So it's, yeah, we found that a lot was that inconsistency of, it's not something, again, that's enshrined in legislation. It's not something that's a regulatory requirement. It's just something that's in your local policy. So what we started doing is having conversations with, there's a Directors of Nursing Forum for Directors of Nursing who are in mental health and learning disability trust, to start talking to them about how can we work with you to ensure there's a more consistent approach, and that there is, we can share examples of really good policies that take into account the nursing associate role, so that that when you finish your course and you're registered, that you can have that same access to delivering high quality patient care as your colleague in Trust Y just a bit further down the road, whereas at the minute there's a massive inconsistency. And again, and the Directors of Nursing agree with this, to be fair, there's some nursing associates have been able to come out, register, go back to their workplace and really trailblaze and be given that space to carve out their own role and identity, and yet in other areas have been really quite constrained, and that's made it really hard for that, not only for the increase in numbers of nursing associates, because if you see a role and think, God, that doesn't look really much different from a healthcare support worker role, or it doesn't feel very innovative, it'll put people off. But also I think the fact that the Directors of Nursing, by doing that, have kind of stifled innovation and potentially stifled really, really good practice. So again, we're going to do work with them about how can we learn from some trusts that are doing amazing things. Like there's a colleague who, she works in an eating disorder service. She now has her own caseload. She, develops, she doesn't supervision, but she's developing and implementing care plans. She manages her own patient care. She just gets on with it. And then there's other colleagues in primary care who are nursing associates who again have their own clinics that's around physical health checks with learning disability, but they will see those patients on a regular basis. It's like having their own caseload that they care for, get to know really well, develop their skill set, but then they become a source of advice for other colleagues in that practice as well. So we're talking to them about how do we learn from these really brilliant examples where people have really run with that role and taken an absolute advantage of the stretch that a nursing associate can offer, but also how the rest of us can learn from nursing associates. So the ideal would be that we end up with almost like a toolkit that we can take out to trust, that we're just having a conversation with them at the minute about what would that look like, how would we do that to give it that consistency. So again, like I say, you guys probably have the toughest task because you're doing the trailblazer, you're carving the path. And the idea is this, that it hopefully makes life a bit easier for you, but that those that come behind you have a much clearer path of, I know what role I'm coming back to, I know what my remit is. And then it makes it easier to articulate to fellow professionals as well about this is what I do and this is what I bring and this is why this is my remit and this is why this is your remit, to try and remove any of that suspicion that you might sometimes have from registered nurses who get a bit confused with what does your role do compared to mine. So just trying to troubleshoot as much as we can in advance so that you're not having to plough through that and work through that. And of course, our agenda is always that we want more nursing associates because he's such a great addition to the workforce. So it is about easing the way, improving the consistency and making sure we can maximise the skills that you bring, really. That's the big plan with the Director of Nursing, definitely.
Thanks, Ellie. Does anybody have any comments or reflections, questions that you would like to ask Ellie? Darren?
Yeah, yeah, it's really good, really interesting. There's just a few points. One of the things, I mean, maybe this is a bit parochial, and this is just something that I've noticed from our own area, but I think there's also an opportunity to sort of advocate for the support workers and the nursing assistants and have a voice for those people as well. They seem to, because so I think that's really a positive thing. And one of the things I've noticed in my area, which I haven't challenged yet, and I need to challenge, I've not been particularly happy with it, is that sometimes not always included actually within somebody that have their separate nursing meetings. And it's you're sort of, do you see what I mean? I know you're not a band 5 nurse, but it sends out quite a strong message. I know I don't take it personally, but thinking more broadly about the future is like, well, that's straight away there's something not right there, because it has to come from a mindset or conceptualization around what straight away, doesn't it? You're there and that's an issue with the NHS because of the hierarchy and all of that. So I think there's a few things there, but also I think there's opportunities clearly within the physical health specialisms, but also to lead on other areas.
Absolutely.
This program is all about influencing change and so on. I think that's really important. So that it's not just, well, you have to be a band 5 or band 6. An example. So, for instance, they gave out, and I'll shut up in a minute. I really will. They gave out expressions of interest for leading on safer wards. And I don't know a huge amount about safe wards. I've read a little bit of it. It's best practice stuff, and it looks quite interesting. And I said, look, I'd be happy to get involved in that. I don't know if it's a band 5 thing. I don't know what I'm waiting to hear back on that one. But that's the example. And these are because I think otherwise you disempower people, and and obviously that you want to energize it, don't you, and take full use of people's training and enthusiasm to get out there and make change. That's what I think.
No, I think you're right, and I think there is this kind of, you're right, in the NHS very much, it's this bureaucratic hierarchical structure, isn't it, that kind of, I think you get so used to it, you stop seeing it after a while, and what we don't want, I think, is, and this is the work we're trying to do again with the Directors of Nursing, is we don't want registered nurses to go, oh, well, it's just our little club and you're not allowed in, which is just ridiculous, because like, when I go back to when I did my training, one of the first things I was taught by my mentors was, big part of the privilege and responsibility is that you bring forward the next generation and you support them. So that's the same with yourselves. It's like, this is the next generation, be it the next generation of nursing associates or nursing associates training people my ends. It's the next generation, and we're all colleagues. And at the end of the day, if we get the mindset, which we should always have, that this is about improving patient care, then we should just work together. And I think sometimes nurses, when we feel a bit threatened, we get a bit precious and we start to close ranks. And it's like, there's no need to do that. We are, you know, we're better together at the end of the day. And they're complementary roles, in my view. They work so brilliantly well together. And well, we like skill sets, you've got them. And I think it's about saying, isn't that brilliant? Because where I lack, you have. So therefore we work together and we're more inclusive, then we're better as a whole. But you're right, I think there's a lot of barriers to be broken down with quite traditional nursing mindsets that will probably still exist, that it is about breaking that down and challenging it. And as nurses, we've got a massive responsibility to talk to our colleagues and go, come on, behave, be a bit more inclusive, start, you know, stop going back into your little silo and feeling a bit nervous. This is about working better together, and we do work better together, and we'll learn from each other and support each other. And there's absolutely no reason to feel threatened. You should be welcoming. This is a brilliant development. But you're right, it is about what else can be done and what others of us, what can we do to start to break down those barriers, definitely. And I don't think safer wards are defined by bands at all. It is about who's got the right skill set to take this work forward. That's what it's about. Definitely.
And it's sometimes, I think, Darren, that's a really good example how these kind of practices become an artifact of that culture and that power and hierarchy and all of those things. And if we can just raise a question, you know, what's the rationale for that being a meeting, that starts to just undermine it and chip away at it, doesn't it? It's a good way to start to almost get people to recognise it. They won't see it. They won't see it as that. Yeah.
True.
It's a really good question. Thanks, Darren. Anybody else? Questions, comments? Naomi?
Just to very helpfully illustrate the differences between various different areas. I've almost got a slightly different opposite problem in that, because I've got the enthusiasm and I'm hoping to drive through change and things like that. I'm actually finding that people are kind of not giving me stuff to do because they're realizing that there is a lot that I am doing, and they're kind of looking at my role versus the band 5 and 6 role, and they're saying, well, you're doing that already, and this person is a band 5 and isn't doing it, and you know, so what should you be doing, and is it too much given your pay level and your and I'm like, I don't care about the pay, I'm talking about the experience and for the patient, and you know, it's just
it's a really good point, Amy.
It's about the trust. It's about the trust perception, and almost about the trust being brave.
Yeah.
And letting us run with it.
Yeah, and I think there's that thing, isn't it? Like I said, it's that old-fashioned hierarchical. Oh, I'm a band 5, and as a band 5, I have a very rigid skill set and a very rigid. Well, then change it. You know, then this is a brilliant argument for saying, is your band 5 working or your band 6 working to the top of their potential? Is there something else that they could and should be doing that makes a better use of their skill set? If you're capable and competent, brilliant, that should be encouraged. And then you should be thinking, well, what do we need to change with the other bandings? What more could they be doing, or what different things could they be doing? So it's complementary. But you're right, it's good to challenge, because I think often things will have been in place for years and just never looked at, and then it just carries on and carries on. So it's good to give it that challenge and think about making changes, definitely.
Thanks, Naomi. And Tarella, I saw your hand up. Did you have a question? Or you on mute?
Yeah, I did. Upon qualifying 2 years ago now, I didn't want to progress to being a band 5. I was quite happy with the band 4 role because I felt it was unique. With the things I do on my ward, the band 5s don't do it. I do ECG, I take blood, you know, I work alongside junior doctors. And when I looked at, was it last week or the week before, I got my wage slip, and I looked at my wage slip. Naomi said she doesn't care about the money. I do care about.
I do care about the money, but you know.
You know, because we do so much, right? Where I'm on my top cap now, 24,157. right? Band 5 then starts from 24,900 and something. That is quite massive, you know, as opposed to what we do on the ward. So when Ellie mentioned a progression path, I don't know how we're going to progress from where we are now to anything different. So at the moment, only yesterday I rang my uni, Salford, to see if I can do my master's, because I got previous degree in teaching. You know, I'm like, rather than go spend 2 years on apprenticeship and come out as a band 5, I might as well go do my master's, you know, and in 1 year and then come out and specialize maybe in diabetes care, because that's what I'm looking at. But that's taking me away from my band 4 role that I enjoy. I enjoy the physical aspect of things, you know. And on my ward, like I said, I don't know if any one of you remember, the Dynomap is my designer handbag. I have it all the time with me. I'm checking out patient to the point where we had a COVID case on my ward, and of course we don't know. We don't have COVID written on our forehead. I looked at the patient. I'm like, that man don't sit right with me. So I asked him, is it okay if I did your vital signs? He was like, yeah, it's all right. So I went with the student, the TNA, I went with her, we got the Dynomap, we checked it. His pulse was 121. Yeah. His blood pressure shot through the roof. His temperature was 38, and he was sat there amongst other patients in the day area. So straight away, nurse in charge, this guy needs to be isolated because we don't know what it is. So straight away, the PPEs and everything, we isolated him and got that. So that I enjoy that aspect of my role. But when I look at there's no progression, that's it. I'm capped now at 24,157. I got bills to pay. You know, I want to do more. I want to see myself, you know, maybe the next project, but there's nothing. That's it. You know, so that worries me. And for me to now, at my age, 50 something, thinking about doing a master's, and I never wanted to do, you know, but for me to be at same level as the band 5s that I do more on the ward, I do more than them on the ward, you know. So I just thought, no. So I don't know what HEE can do for us. I love my band 4 role, but we need to have
I would say it's one of those weird ones. It's unfortunately agenda for change. I have literally no influence over what. So it's weird because I remember agenda for change coming in. Shows how old I am. And they brought it in. The idea was bring agenda for change in. You've got really clear bandings and everybody knows where they sit. But you're right. I think when the nursing associate role was introduced, that wasn't in collaboration with any changes to agenda for change. So it's kind of slotted into an existing pay structure, which if it's reviewed, it would be a governmental decision. It'd be well out of my hand, but you can appreciate why, and I can absolutely appreciate that you're thinking actually financially this is it isn't going to change unless you go up another banding. And I don't know if there's any discussions about reviewing agenda for change, to be honest. That's the only thing, as far as I can tell, that would, from that pay perspective, make a difference and give you any wiggle room. But I appreciate it's really frustrating, because then you're thinking, do I kind of do an apprenticeship and skill up and train or not? And it'd be dreadful to lose that skill set. But on the pay front, I don't have an answer, unfortunately.
Okay.
And it sounds, Ellie, just looking at the chat box, there's a few others here that are experiencing a similar scenario. And I wonder, we gathered the information from a few of this cohort, and our plan was to present that back to the All England Steering Group. What I'll suggest, Tariella and Naomi and Chris, who've added to the chat, is that if I circulate that paper and you provide me with your feedback, comments, and we add in a section around this specific issue, then we can take it to the steering group where
flags it up.
The right people are there that are addressing this issue, aren't they? They're at that around that table, and if they want to, if we can offer the opportunity for them to come and speak to you. Absolutely. Thank you. Really, really excellent point and very well made. Thank you, Tariella.
Thank you.
Okay, well, we'll move on now. We'll thank Ellie for joining us and having almost an audience with Ellie, which was really valuable for us. Thank you so much. And you know, I know that Ellie has the ear of lots of influential people, herself as influential, but also influential people at HE, and she'll take all that intelligence that you've just given back to that environment. So thanks for joining us, Ellie, and all of our influential and inspirational comments.
All right, thank you very much.
Take care, Ellie. Bye.
Bye.
So we'll move on now, guys, to our awarding of our e-certificates. Now, we haven't got the whole cohort here, so what I'll do is to call out your names individually. And what we'd like you to do, if you can all pop your cameras on if you are here, and what we'd like you to do is to shout out when you hear your name, that word that you identified in your reflective discussions that symbolises either the impact of this programme or your intention moving forwards, and we'll collate these together and make these a memento of the programme for you. You've all been emailed your certificates, and when we get back to our offices in central London, whenever that might be, then you will get a physical certificate in the post, and also a badge, which the very sought after, these pin badges. It's a bit like this one. I think Rita might have got one, actually. She might be able to show you a pin badge that gets sent out to all of our alumni. So there you go, that's what will come in the post to you.
Can you see that?
Everyone see that? So that's on its way at whatever point we're allowed to get on public transport again and get ourselves back into central London. So so that will be there.
Just to say that, sorry, Gemma, give me an opportunity to say something. Sorry. So I happen to have a call with somebody that I had been on one of our programs probably a year or so ago, and she wanted some mentoring. And so I arranged a Zoom call, a Teams call with her, and proudly on her dress, on her lapel, was this badge. And I thought, oh, she's done that on purpose. She said, Greta, it never leaves my lapel. She said, it's always there. So they're not the highest quality. We're not talking marvelous enamel, Fabergé enamel and silver, but they are to be worn with proudness. And just understanding that what you've been through this leadership program. So wear it. I know you haven't got lapels, but you've got shirts and you've got hoodies and whatever else, dresses and t-shirts, but please wear it with pride, and I think it will spark off quite a lot of attention, and hopefully the next TNA who you're mentoring who becomes an NA, and you can send them our way for the next leadership program.
Yeah, brilliant. Thank you, Greta. So let's call out everyone's names and hear those words then. So I'll go in the order of everyone that's on the list, and if you can pop your camera on, that'd be lovely to be able to see your faces as well. So Angela first.
My word is courage.
Thank you, Angela. And Jennifer.
My word was confidence.
Thanks, Jennifer. And Zoe?
Enlightened.
I love it. Thank you, Zoe. And Chris?
Encouraging.
Brilliant. Thank you. Darren?
I think my word is impact.
Yeah, I say that one a lot. Fatima? Fatima? Be able to hear us. And Magda?
Mine was confidence, strength, but I will add empowering.
And Naomi?
Networking.
Networking, brilliant, absolutely. And Tariella?
Valued.
Thank you. Okay, well, that's fantastic. Thank you so much. And we will send this recording out, and we'll make sure you have opportunity to share this with the rest of your cohort that weren't able to make it today. Now, our next just small section of the session is really to introduce you to our alumni community. So I said at the beginning of our session today that you are now part of this fabulous F&F network, and this is a network that, as Greta said, when you wear that badge, connects you and opens up doors. Even today, having that conversation with Ellie, I know will have huge impacts on a national platform, and we don't want you to underestimate the potential of that. So Adam said hello at the beginning of the session, but he's going to talk to you a little bit more about that, those alumni opportunities.
Thank you, Gemma. Just like to thank everyone for their contributions today. Claire, Henry for her introduction, and Ellie Gordon for the speaking, and all the other contributors. It was very inspiring. Thank you very much. And I'm jealous, I haven't got this pin badge. I'd like to have one as well. So I'm very envious of all of you regarding that. Okay, so the benefits of joining. Well, so now that you've completed the program, it opens up a lot of opportunities. You're going to be part of the newsletter, the alumni newsletter, which will show you all our benefits that we do and the online workshops that we have that tailor to all different aspects that will hopefully inspire you, wellbeing courses. Also, it's important that you join our online community on the portal so you can share your experiences and become part of this wider network that we have. That's about it, really. I mean, also, sorry, there's also case studies. So what we do is also take your stories of your journey through not only the program, but how you got to where you are today. And we are making sure that more and more of these are being put on our website and distributed so we can share your story and your journey. So please contact me if you'd like to be part of that so we can take that journey forward. That's it.
Thanks, Adam. And that would be wonderful, actually, because we've only run this cohort and one other cohort for nursing associates. We don't have many case studies of people that have been on our programs as nursing associates and where it's taken them. So it'd be really great to hear from you. But ultimately, I think what's important when it comes to the F&F alumni newsletter is there are lots of opportunities, sort of calls to action. Do you want to get involved in this policy working group? Do you want to author a chapter in one of our F&F leadership development books? These are the kinds of things that we put the opportunities out for. And what we don't want you to think is, oh, they don't apply to me. So they absolutely do. You are 100% a valued member of our alumni community, and your perspective is a unique one that we want to be able to represent as well as part of that community. So don't assume we're talking to somebody else, or oh, it'll be Chris that will reply to this one, or this one's for Magda. It's for every single one of you. So please do respond to yours. So my last message to you really is to I spoke about Greta at the beginning of the session and said she would be here if she absolutely could, and she's made it. And I know that she'll want to say some words to you on behalf of the foundation, but Greta is our CEO and a nurse, and also recently awarded her CBE for her contribution to nurses. And I'm really proud to call Greta my boss. I work in the best place ever because I get to do things like this every day. So it's great. But I'll hand you over to Greta now for some final messages.
Thank you, Gemma. And listen, thank you so much for sparing the time to come on this celebration day today when the world of health and care is in such turmoil, and well done for putting your CPD first. And I guess those of you who are here really value the fact that you've want to celebrate what you've achieved in this last 6-7 months. I wasn't here when you presented your projects, but I did pop in when you were in your breakout session and asked Gemma how it went. She said it was incredible. Really, she was really proud of what you've achieved. And just think of the power that you've been able to demonstrate in the last 7 months. The stuff that you thought you'd probably never be able to do, and you've done it because you've been given the authority to do it, and you've stepped up to that authority, and you've shown your place within the team. And I totally understand. And so Tarella, I've heard what you've said about the pay, and it does seem that I guess if you're a nursing associate, this is not my bag at all, but I was actually listening to what you said about pay. And if you're a nurse, of course, a registered nurse, there's many pay bands that you can go up. And I guess with nursing associates, I think that they probably thought about the pay band of a band 4 with a ceiling, so the increments go from here to here, but never really thought about and what next. So I was thinking, is there a possibility to have senior nursing associates, for instance? And I wonder, Gemma, I mean, we're not, so the point to say is we're not a trade union. We're not here to talk about pay, but we are here to listen to you. You have got an independent voice, and we want to hear your independent voice with our independent ears. So Gemma's got a fab relationship with the mental health section of HEE. And I think that probably Ellie did go away listening to what you said. So I wonder whether we could commit to carrying on that conversation with you. I'm not sure how far it would get. And of course, Agenda for Change is part of the Health Act. So as Ellie said, these things take time, but at least we could start a conversation. So anyway, less about pay, but more about what you've done. Absolutely fabulous. And I've been a registered nurse for since 1983. I keep forgetting how many years that is. Lots of years. And it's been in the last few years that, of course, the profession's expanded, and it's expanded because of nursing associates. And I was with Health Education England in the very first conversations about nursing associates, and we took information from across the world about how they've managed nursing associates, what's the role, what's the scope, and it all, you know, it was health education that really pushed that in England. Of course, none of the other countries, UK countries, have got nursing associates, so you'll very proudly sit within England. But well done for putting yourself through this, first of all through your nursing associate training program, and then for identifying yourself as a leader and saying, actually, I want to do this leadership program. I guess for some of you, it might have pointed out the fact that you're all very good anyway, brilliant, which is why you've been nominated to be on this program. But for some of you, it might have not quite scratched an itch, that the itch might get even scratchier, and you think, okay, now what do I do? And that's fine. That's about leadership development. You know, you probably didn't know, you probably had an idea that you had something in you, but actually it's not until you get a platform like this and you find people to mentor and coach you that they really encourage you to do even more. So really well done, and it's fabulous to have a cohort. We've had nursing associates we had 2 cohorts of nursing associates probably 2 years ago, and some of those were from a mental health background, but to have a whole group of you, and actually people say it's fabulous to learn within your own professional group rather than be dispersed amongst other specialties. So I'm really hoping that you've picked up some rich experience in this group, and importantly, you've got some friends for life. You've got colleagues for life. You've come from all over England, and whichever way you communicate, I would suggest it's probably WhatsApp, I don't know, but for whichever way you communicate, please, please, please keep that network going. I've done a few leadership programs in my career, and since one of them I did was 2007, and we're still part of our own action learning set. We still keep in touch with each other. Another one I did probably 4 years ago, that's another group that we're in touch with. And they're always there, these people in your group now will always be there to pick up the pieces when you just want to say, help, how do I get through this? And Gemma, did they learn co-consulting?
Yeah.
Okay, so please, you know, just keep practicing co-consulting. It's a fabulous skill to have, and you really will be able to help your colleagues out in this. So not only your colleagues in this Zoom call today, but your colleagues at base. The passion and commitment that you've shown as part of being on this program and sticking it to the end is incredible. And I think that says a lot about why you were picked to go on this program. I know that you might have nominated yourself, but somebody had to sign you off, and they wouldn't have signed you off if they didn't see a future for you. So really fabulous. So there will be lots of opportunities in your in the future. This is just one thing that you've done. Take some time to consolidate what you've learned in this program, but use it to find the next opportunity. And I guess that sounds a bit like I'm suggesting that you should jump ship every so often. Don't jump ship. It's just if somebody gives you another opportunity on a plate and you think, well, that's absolutely great, I'm not sure where that's going, but it sounds amazing, just go for it. And I think the more times you just go for stuff, it doesn't matter. I mean, actually, I can probably think of a few times in my career where I've picked up the wrong job. I thought, oh, that looks nice and shiny and bright, I'll do that job, incredible. But actually, probably a really rubbish decision. So it doesn't matter. You just have to commit to a rubbish decision. Just move on and find the next thing that you want to do. So the nursing profession gives you fabulous opportunities. What a time to be a nurse, a registered nursing associate, a registered nurse at this time. The world has seen health and social care absolutely transform. And I suspect that, I think Gemma mentioned somebody from an IT background is now a nursing associate in your group. And I suspect that you've got lots of ideas for change, how you can make change better for the people that you care for. Just keep changing stuff. The NHS changes all the time. And I guess the best leaders are the ones that have always got a good idea about how to make it better. So never be afraid to put your hand up. I don't know whether any of you, if you're in a ward-based situation or you're in an office where you're community-based, is if there's a board, a suggestions board for change, fill it with post-its about what you think is the next thing that you want to change, and just to reevaluate what you've done. But always put the patient or the service user first. You know, they know the answer to how things happen and what should be better for them. So if somebody gives you a good idea about what needs to change in their pathway, just go with it. You'll be eternally loved for it. So reach for the stars. This is the beginning of, it's not the beginning of the end, it's the end of the beginning, or something like that. Anyway, that's a Churchill expression. But please accept, this is, you're not stopping here. Just go for it. You've got the fire in your belly now to do really great things. And for those of you who want to go on to the registered pathway, whether it's through a graduate program or a nursing apprenticeship, just do it. Find people who will support you, because you'll have a great career, whether you stay as a nursing associate or whether you want to change to the registered pathway. I'm an adult nurse. I was a midwife straight after I trained as an adult nurse. I've always been an adult nurse. I've always worked in secondary care, in acute care, and I through this pandemic, and Gemma and I have both supported our local NHSs at the start and now through the vaccination programme. I mean, there's not an ounce of my body that doesn't say how proud I am to be a nurse still. Nurses have done such an amazing job during this pandemic, and if it wasn't for you guys, your service users, your patients, the people you look after, would have had a really everything's shocking, but they would have had a more shocking time. So really take strength in what it is that you do for them. I don't know whether Gemma said why I wasn't here at the start of the session. Yeah. So off I've gone to go and fetch my husband, who had a MI on Friday night. And as an acute nurse, that came second nature to me. Actually, I guess as an acute nurse, you deal with the physiology and you don't deal with the mental well-being. And it suddenly occurred to me in driving home with him in the car, actually, Grecia, you've got to focus on something else now. This is about getting him better. He'd be fine. I'm sure he'd be fine. But actually, there is a sense of, gosh, I could do with a bit of mental health training here to make sure he feels wrapped around. So by saying that to you, I want to say you are really special. You do a fabulous job with the client group, the service users that you look after. Don't ever lose those skills. Just keep going for it and use each other. And as Adam said, join our alumni. You are our alumni. Register for our portal, because that's the other thing that I've learnt as part of leadership programs I've been on, is being part of a portal, so you can log on, you can pose questions to each other, you can ask a question about, has anybody got a document that supports and then you can share documents with each. Just fabulous. It's a really great way of connecting with each other. So you are alumni now. The door is never closed for you guys. It's always open. And we expect it to always be open. You've got open access to any one of us, including myself. Even though I haven't met you, I feel as if I know you through Gemma's experiences of working with you. And just use us. If you get stuck in your career and you think, gosh, what next? I don't know what to do next. I want to move on. Do I stay? Do I go? Just come back to us. There'll be somebody that can spare you even 5 minutes to find the next person for you. So go forth and multiply. Find the next nursing associate that you want to champion to go on this programme, and keep together, keep connected, because the sum of the part, what I'm saying, as a collective, as one team, you are much more powerful than 15, 16 individuals. So it's Team Mental Health Nursing Associates FNF, if there's even such a hashtag. Anyway, fabulous, lovely to meet you all. Please stay in touch, and really, really well done. Westminster Abbey, you might have remembered, was perhaps on the back of your programme donkeys years ago when you first applied as an opportunity. We didn't have it last year, and we can't have it again this year because of numbers, but we will have just a really, really small gathering. So I'm sorry that you can't come to Westminster Abbey. We will hopefully stream it, so we'll give you all the link to look at it as we celebrate nurses, midwives. Everyone's sacrificed a lot during this time, but we also want to give thanks to the thousands and thousands of lives nurses and midwives have saved at this time, including you guys. So bear with us. I hate that expression. Why did I just say that? That's what people say when you order stuff on the phone, isn't it? Bear with me. Anyway, hold on to your hollyhocks. Maybe that's the best thing. Hold on to hollyhocks, because you will get an invite at some point when this whole hideous world is calmed down a bit. So thank you very much for your commitment, and we'll see you the other side, hopefully.
Absolutely.
Well done.
Thank you, Greta. Thank you so much. So only final thing, you'll get an email after today. It will ask you to complete an evaluation. Please do that. We need that data to be able to offer this opportunity to others going forward. So we would also want to follow your experience for a number of years after the programme as well. So if you'll give us permission, we will continue to stay in touch with you and track this journey that you're going on and the different paths that you are choosing to take. I think for you guys that's even more relevant and interesting than any of our other groups. So we would love to do that. And I will also send out that document to you all, and those of you that have got something that you want to say, as Greta said, from an independent perspective, as FNF, we're not a union, we're not politically affiliated, but we can put forward your voice. So we will absolutely do that on your behalf, but we'll need that information from you and that intelligence from you. So we'll send that out today after the session as well. So it's been a lovely morning. Thank you so much. I'm always come away from these sessions feeling so energized, and today has been absolutely exactly the same. It's been an absolute pleasure. And stay in touch with us. Take care, just the start of our relationship, and we'll continue to support you moving forward in whatever journey you go. See you later, everybody.
Thank you.
Bye-bye.
Bye-bye.